Good afternoon, and to everyone who is watching this session. Today we have with us Dr. Roshita Khare. Today she will be sharing her insights on the topic understanding postpartum depression. So, Doctor, could you introduce again yourself?
Yes, myself Dr. Roshita Khare, and I'm a consultant psychiatrist and sexologist practicing in Pune, Manas Clinic. It's on Pan Card Club Road.
Okay, thank you so much, ma'am. We will start with the conversation now. My first question is what are the key signs and symptoms of postpartum depression, and how do they differ from typical mood changes after childbirth?
Okay, so post today I'm going to talk about postpartum depression, and I want the audience to understand the symptoms of postpartum depression. So, postpartum depression is a type of depression that occurs after childbirth, and the key signs and symptoms include persistent sadness or low mood that lasts more than 2 weeks, loss of interest in day-to-day activities or those activities which were enjoyable for the female before delivery, extreme fatigue or lack of energy, irritability or anger that may be directed mostly towards the baby, and feelings of worthlessness or guilt, difficulty in bonding with the baby also, and anxiety or excessive worrying about the baby, mostly around the health of the baby, whether the baby is feeding properly or not, whether the baby is sleeping properly or not, or whether I am a good mother or not. Sometimes sleep disturbances are also associated with postpartum depression, difficulty in concentrating, changes in appetite. Maybe the female may have increased appetite or maybe decreased appetite, and thoughts of hopelessness, worthlessness, helplessness may occur. And in extreme cases, there may be signs and symptoms which can lead to self harm or harm to the baby also.
Okay, thank you, ma'am. How prevalent is postpartum depression, and how what factor contribute to its occurrence in some individuals and not others?
Okay, so postpartum depression is relatively a common disorder, and around 10 to 20% of new mothers face this issues. But yes, the prevalence depends upon the geographical background and socioeconomic status of the family or the mother, and other means factors which are responsible for the prevalence of postpartum depression include the access to healthcare services.
Okay.
Yes.
So, what are the potential risks and consequences of untreated postpartum depression for both the
Okay.
mother and infant?
Okay, so there are many risk factors which can contribute to postpartum depression in a female. We can classify that into biological factors, psychological factors, social factors, and lifestyle factors, as well as pregnancy and birth related factors also. So, coming to the biological factors, whenever a female is pregnant, so the level of hormones like estrogen and progesterone that is on a peak level just to maintain the pregnancy, but post delivery what happens, there is a sharp decline in these hormones which leads to mood swings. So this increases the risk of postpartum depression in a female. Other thing, during pregnancy many females develop thyroiditis, means inflammation of the thyroid gland, which can lead to hyperthyroidism or hypothyroidism, which again leads to mood symptoms and increase the risk of postpartum depression. Genetic predisposition, if a female is having family history of this depression or anxiety, they are more prone to develop postpartum depression post pregnancy. Then coming to the psychological factors, if a female is having past history of mental disorder, they are more prone to develop postpartum depression post delivery. And if a female have a low self esteem or low in confidence pre delivery state, so they are also more prone to develop the postpartum depression thing. And if there are any negative birth experiences, like there is a difficult labor or a difficult delivery, or during the pregnancy there are many complications, that also increases the risk of postpartum depression in a female. Then coming to the social factors, if the female is having a very poor support system, that increases the chances of postpartum depression, because there are overwhelming feelings how I'm going to take care of the baby if there is no support system. So that is stress increases the prevalence of postpartum depression in a female. Then if there are marital relationship issues with the husband, So because of the misunderstanding, miscommunication, again there is an increase in stress level which can lead to postpartum depression in a female. Then if a female is a single parent due to some reason, if their husband is separated or husband died, so again all the burden is on the mother, and that increases their stress, and that can also lead to symptoms of postpartum depression. Then coming to this other risk factor, like I told, lifestyle factors. So if there is sleep deprivation, because if a baby is born, we have to work with the baby, and if there is sleep deprivation, if the mother is not able to sleep properly, so again that will be increase the stress, and that will also lead to the symptoms of postpartum depression. If there are any financial stresses, because newborn baby is there, so there are increased demand, and at the same time the female have to manage the household chores also, household expenses also. So sometimes there is an increased demand, financial demands, which can lead to stress and again increase the risk of postpartum depression, and certain sometimes unrealistic expectations. So neighborhood and parents, now you are a mother, so you have to do this, you have to properly breastfeed the baby, you have to take care of the baby, you should be a good mother. So just to meet those unrealistic demands, the female may get stressed, and that can again lead to postpartum depression. And the last but not the least, if there are any birth related factors like pregnancy related factors, if the baby is not a planned baby, so that increases the stress, and that can lead to postpartum depression later in the after delivery. And if there are multiple births, like if it's not a single pregnancy, if twins or triplets, so again the mother have to take care of all the three babies at the same time with the family, so again that also increases the demands, and that increases the stress, and again the risk factor for the postpartum depression.
Thank you, ma'am. What preventive measures can be taken during pregnancy to reduce the risk of postpartum depression, and how can we parental care be optimized for mental health?
Yes. Preventive measures which can be taken during postpartum, during the pregnancy, or during the postpartum period, which can help to reduce the risk of postpartum depression. First of all, is the mental health screening during pregnancy, early identification of the risk factors, and regular mental health screening with the doctor may identify the women who are more at risk for developing postpartum depression, and early assessment and early treatment can help the patient to not develop the postpartum depression. Then assessment of the social support, evaluating the woman's social support, whether there is a good support system, parents are there, or helping hands are there. So if that is there, so again that reduces the risk for postpartum depression. Then a history of, if there is any history of trauma or abuse in the female, and we can identify those females, we can counsel those females, so that also reduces the risk of postpartum depression. The other thing which can help to prevent postpartum depression is education and awareness. Education about postpartum depression, actually providing expectant mothers with the information about the signs and symptoms of postpartum depression helps in early diagnosis and intervention of the postpartum depression. Then setting realistic expectation, educating mothers on the challenges of parenthood, and encouraging realistic expectations about birth, breastfeeding, and infant care. Again, partner and family involvement. We must involve the partner and the family for once the baby is born. How you can coordinate with the mother, how you can coordinate so that there should not be overwhelming feelings of child care with the mother. So that also reduces, and that also comes under the preventive measure. Then therapy and counseling session. Prenatal CBT has been shown to reduce the risk of postpartum depression in high risk women. And interpersonal therapy focuses on improving interpersonal relationship and social support, both of which are protective factors against PPD. And last but not the least, support groups. Engaging in prenatal support groups, either in person or online, can help a woman build connection with others facing similar challenges, reducing feelings of isolation. And yes, exercise, balanced diet, and sleep hygiene is definitely going to play an important role in preventing the occurrence of postpartum depression.
Okay. How can self-care practices, including the mindfulness and adequate sleep, be incorporated into the postpartum period to support mental health?
Yes, incorporating mindfulness into postpartum period is definitely helpful because mindfulness involves being fully present in the moment without judgment, helping mothers manage stress, stay calm, and reduce feelings of overwhelm. It can be practiced in several ways, like mindful breathing. New mothers can engage in short, simple breathing exercises even for a few minutes a day. Deep breathing helps them to calm down their nervous system and reduce stress. Like a few techniques which I can tell you, like box breathing. 3 to 5 minutes of breathing breaks, including deep breaths to relieve stress. Then mindfulness meditation, setting aside at least 5 to 10 minutes a day for mindfulness meditation can help new mothers reduce anxiety and emotional stress. Mindful feeding and bonding with the baby, focus on the sensations, sounds of the baby movements while breathing deeply and staying present will also help to reduce the stress. Then mindful walking, new mothers can take brief mindful walks with or without the baby, walking while paying attention to their breathing, the sensation of the baby feet, means they can take along the baby with them and then they can feel the baby sensation, which can also help to develop the bond with the baby and reduce the stress. Journaling or gratitude practice, spending a few minutes each day writing down positive experiences, even small ones, can help shift focus towards gratitude and foster a more positive mindset in a mother. And yes, you were asking about the prioritizing adequate sleep also. So sleep when the baby sleep and share responsibility with the family. Ki, yes, I am sleeping now. If the baby wakes up, so you take care of the baby. And yes, a little bit of sleep hygiene, like listening to some soft music before going to bed, will definitely help a female to maintain the sleep hygiene and help to maintain adequate sleep also.
Okay, thank you so much, ma'am. These are all the questions that I had for you. Do you want to
Yes.
convey any message for the audience?
Yes. Yes. So I will just say that postpartum depression is common but often under-recognized mental health challenge that can profound effects on both mother and their families. And it is crucial to understand the postpartum depression is not a sign of weakness. क्योंकि काफी moms को लगता है कि if they are suffering from postpartum depression, that makes them a bad mom. They are a weak mom. So it's not a sign of weakness. It's a medical condition that requires attention, understanding, and treatment. And though early identification, supportive intervention, and comprehensive care, mothers can find relief and recovery. That's all I want to say. So
Okay,
encourage
thank
open
you so
dialogue.
much. Thank you so much, ma'am. We are pleased to have your time. And I hope the people who are watching this session will get the benefit. And it was very insightful session with us also. Thank you so
Yes.
much,
Thank
ma'am.
you. Thank you so much.